So, has it always been this way? How many of you have heard of the medical anthropologist and dentist Westin Price? Okay, good. So Westin Price was born in Ontario and moved to Ohio, where he had an exceptional dentist practice, but it literally bothered him that he was so busy. It drove him crazy that all these Westerners had so much tooth decay and need for root canals. So after about 20 years of practice, he and his wife decided to go search the world for populations that were still indigenous, untouched by a modernized world, right? So the Westin Price study. Do these look like obese, diabetic, indigenous folks suffering from alcoholism? Right? No, look at that warrior, right? Ripped abs. This guy is not 20 on the hill, right? This is a 50-year-old man with ripped abs. Pretty cool. So he searched for isolated primitive groups living entirely on indigenous foods, okay? He found 14 radically different tribal diets provided almost complete immunity to tooth decay and resistance to illness. All right, so again, I thank Dr. Blanchette for bringing two major things to my attention these last 5 years. You gotta deal with dental issues, and you gotta make sure you're not sleep apneic, or you will be building plaque. Those are very, very inflammatory. And these people didn't have to deal with any of them. Didn't matter their race or geographies, they just simply had to be isolated from modernized society. So he did white Gaelic Irish islands, he did mountain regions in Switzerland, he did the Maori in New Zealand, he did Aboriginals in Australia, Bush Africans, Eskimos, North and South American Indians, and it was all the same story as long as they didn't get stepped on with the processed grains, the sugar, and the alcohol. This is how they were looking and operating, right? Do these guys need the low T center, testosterone? No, right? So our American men are feminizing, and it's the diet. You know, it's not a lack of low testosterone centers. So, pivotal moment in the history. These groups were totally isolated from civilized ways, and Price had one tool with him to document it, and it was a camera. This was in the 1930s, and he and his wife had a camera. Here was the Maori, and this is Westin Price language. The Maori have had the reputation of having the finest teeth and the finest bodies of any race in the world, right? So look at this supreme physique. This tribe in New Zealand literally had gorgeous skin and hair and muscles and stature, no osteopenia, osteoporosis. But he was a dentist, so he was just fascinated by the jawline. Did they need their wisdom teeth removed? No, they had the jawline to handle wisdom teeth. You see any crowding here? So this is what happens when they were eating an indigenous diet. The one thing he found with all 14 civilizations, whether white, black, brown, Maori, north, south, is they all had tons of high levels of fat-soluble vitamins in animal products. Regardless of where they were, that was the consistent thing. So, Price's research proved conclusively that dental decay is caused primarily by nutritional deficiencies, and that those conditions that promote tooth decay also promote disease. So these folks didn't have floss or toothbrushes. Now we need them because we had an American start on diet and exercise, right? And I'm all for brushing and flossing, but it's fascinating to think that they didn't have modern teeth cleaning tools, you know, or xylitol toothpaste or anything else. They just had really great food, okay? So children born to parents consuming refined and devitalized foods suffer deformities. So the whole fascinating thing about Westin Price is he was on the precipice of the last indigenous societies in the 1930s. So he got to see the last people in the hills, the last people on the sea, before the Western world brought in what he called civilized diet. You know, you could throw a couple of other words in front of that. Lousy diet. We'll keep it rated G, but needless to say, they were doing very well when they were eating their natural local diet. So here's what happened to the kids. Okay, this is one generation down. Let me give you the beautiful smiles, beautiful jawlines. Nice. Does this person have sleep apnea? Oh, nice and wide. It's like they're wearing a Breathe Right Band-Aid, right? Then you get down here and you see nose cartilage starts to collapse. The teeth start to crowd and fall out, start to rot. So, you know, pretty tragic. An interesting thing, some of the tribes would save the best food for the new couples who were going to start a family. So if you were about to conceive, they would make sure you got all the best food for a couple months before making babies. So, I mean, pretty good form of prevention. You know, we see children being born pre-diabetic now. So, you know, we gotta go back and figure out where we went wrong. So, all contain at least 4 times the quantity of minerals and water-soluble vitamins in the American diet today. These are vitamins like vitamin B's, vitamin C, minerals. Their diets were 4 times the amount of minerals and water-soluble vitamins that we eat today. But what shocked him even more is they contained about 10 times the amount of fat-soluble vitamins found in animal fats, including vitamin A, vitamin D, and what he called the Price factor, or factor X.